Example number 1. The patient has a follow-up visit for persistent dry cough. He brings the report of the chest X-ray ordered 2 weeks ago by his primary care provider. The final impression documented in the assessment is sarcoidosis. Documented like this, sarcoidosis will be coded as unspecified sarcoidosis, which is not a risk adjustment diagnosis. That is why the healthcare provider should mention the involved organ. Sarcoidosis can affect so many different organs such as the lung, lymph nodes, meninges, skin, heart, liver, spleen, eye. Example number 2. The patient is seen today for a follow-up of type 2 diabetes mellitus. The final impression documented in the assessment is diabetes with other complication. With no clear documentation of the specific other complication, this condition will not be validated. The healthcare provider must document the specific manifestation or complication and linkage using terms such as associated with, or due to. Example number 3. The patient is seen today for a follow-up of hypertension. The physician review the lab results. The final impression documented in the assessment is chronic kidney disease. Unspecified chronic kidney disease is not a risk adjustment diagnosis. Documentation of the CKD stage is a must. The physician needs to document the glomerular filtration rate value and use it to report the specific stage of the chronic kidney disease. Example number 4. A 48-year-old woman is seen today for the loss of appetite and insomnia. The final impression documented in the assessment is major depression. Unspecified major depression is not a risk adjustment diagnosis. Documentation of the severity of major depression is a must. The physician needs to document the PHQ-9 score and use it to report the specific severity of major depression, such as mild, moderate, or severe. He needs to document also the episode of major depression as single if it was the first time, recurrent if this has happened before. Besides the severity and the episode, the healthcare provider must also document how difficult the depressive symptoms make it for the patients to do their job, take care of things at home, or get along with others. The different options are not difficult at all, somewhat difficult, very difficult, or extremely difficult. If the patient checks the not difficult at all box, there is no support for major depression. Example number 5. The patient has a follow-up visit for abnormal pedal pulse of the left foot. He brings the report of lower extremities arterial Doppler ordered 4 days ago by his primary care provider. The final impression documented in the assessment is atherosclerosis. Documented like that, atherosclerosis will be coded as unspecified atherosclerosis, which is not a risk adjustment diagnosis. That is why the healthcare provider must report the location of this condition. He needs to document the arterial vessel involved, such as artery of the lower extremity, aorta, carotid artery, renal artery. Example number 6. A new patient visits his primary care physician for the first time this morning. The final impression documented in the assessment is type 2 diabetes. But in the history of present illness, the physician notes elevated fasting blood sugar in the office today. Probable new onset of type 2 diabetes. Type 2 diabetes is an uncertain diagnosis since it has been documented as probable. The healthcare provider should report in the assessment the highest degree of certainty for that visit. Instead of type 2 diabetes, hyperglycemia should be the appropriate diagnosis. Example number 7. The patient is seen today for swelling of both ankles. After a general physical exam, the physician documents heart failure as the final impression. When healthcare providers report heart failure, they should also document two more information: the type such as systolic, diastolic, or combined systolic and diastolic, and the acuity such as acute, chronic or acute in chronic.